Johnson & Johnson's single-dose COVID vaccine is getting rave reviews from doctors, even though it's slightly less effective in certain cases compared to the Moderna and Pfizer shots. Some people may be waiting it out for a particular vaccine, but is that the smartest thing to do? We took that question to our ABC 15 Health Insider team.
Johnson & Johnson is a very good vaccine. Moderna and Pfizer are the best. And I am going to do everything I can to make sure the residents of the city of Detroit get the best.
The mayor of Detroit making headlines this month after initially declining 6,000 doses of the Johnson & Johnson COVID vaccine. Reportedly because the single-dose shot wasn't as effective as the other two shots at preventing moderate cases of COVID. So here's how they stack up. Both the Pfizer and Moderna vaccines were about 95% effective against preventing moderate COVID cases. The Johnson & Johnson vaccine, slightly less. It's 72% here in the U.S. But experts say you have to remember this. All three vaccines were 100% effective at preventing deaths and did remarkably well at keeping patients out of the hospital. Our ABC 15 Health Insider Dr. Piyush Gupta says if you're offered any of these vaccines, including the Johnson & Johnson one, take it as soon as you're eligible.
I'd argue that this is still incredible. Focus on the fact that the vaccine is effective at preventing hospitalizations and deaths if you were to be infected from COVID. That's a much better barometer for success compared to mild disease. We should really focus on that. Yes, is there an increased risk that you might get COVID? Yes, but if you were, it still reduces your mortality significantly.
Dr. Gupta says there's something else we need to keep in mind.
The second thing I'll say is that we're comparing the Johnson & Johnson vaccine to Pfizer and Moderna when they were both introduced and tested in a different time. You know, the Pfizer and Moderna trials occurred while some of the more aggressive strains did not exist in the ecosystem. Johnson & Johnson was tested not only in America, but also in South America and South Africa, where some of the more aggressive strains have been found. And so that actually builds up the argument that even with those aggressive strains, Johnson & Johnson prevents hospitalizations and deaths significantly.
That's still a huge game changer. And I would imagine really it takes a lot of the obstacles out of the healthcare system too.
The way we get back to normal is to ensure that we have a healthcare system that's not overburdened, to ensure that if people were to get the disease, there's not going to be increased sort of hospitalizations or deaths from it. And this vaccine accomplishes that.
Yeah, great advice there from Dr. Gupta. He also says we need to consider the logistics of the Johnson & Johnson vaccine. It's a single dose. The others require 2 shots. It can be stored in normal refrigeration. The others need to be kept colder. And because of that, it's a lot easier to distribute. Now, if you have an idea for a story or a question for our ABC 15 Health Insider team, email us at healthinsider@abc15.com.